Hello again. I'm Dr. Thomas Gerber, Associate Editor and Web Editor at Mayo Clinic Proceedings. I'm also a Professor of Medicine and Radiology at the Mayo Clinic College of Medicine. It's a new year, and here is some information for you about the Editor's Choice and Highlights articles in the January 2016 issue of Mayo Clinic Proceedings. You can access the articles that I'll mention here on our website for free, at least during the month of January, and some of them actually for 60 days. It depends on the type of article. Our Editor's Choice this month is an original article about changes in the incidence and distribution of radical prostatectomy in the United States between 1998 and 2011. Interestingly, even though clinical trials have not demonstrated any benefit of radical prostatectomy over watchful waiting, and even though key stakeholder organizations strongly endorse active surveillance protocols for the management of low-risk prostate cancer, the overall rate of radical prostatectomy in the population has remained quite stable. There has, though, been a very dramatic shift from open surgery toward minimally invasive approaches. Dr. Mark Tyson and colleagues from the Mayo Clinic campuses in Arizona and Florida performed the study because the data may have important implications for clinical outcomes, healthcare costs, and the delivery of care to men with prostate cancer. This Editor's Choice article is accompanied by an editorial entitled Contemporary Trends in Radical Prostatectomy in the United States, Open versus Minimally Invasive Surgery, that was written by Dr. Stepan Stelela and Mani Menon from Henry Ford Health System in Detroit, Michigan. One of our highlights this month is a special article that addresses the new and important field of cardio-oncology. Dr. Sadir Al-Kindi and Guilherme Oliveira from Case Western Reserve University School of Medicine in Cleveland, Ohio, used a cloud-based healthcare database to identify patients with malignancies that typically require cardiotoxic chemotherapy, and they report the prevalence of various forms of cardiovascular disease in those populations. And in doing so, they make a strong case that there is a substantial but currently unmet need for cardio-oncology specialty care. Our second highlight this month touches upon a very important aspect of professional ethics and conflicts of interest management. Deborah Marshall and colleagues from the University of California in La Jolla performed an epidemiologic analysis of early data from the Open Payments Program that the Centers for Medicare and Medicaid Services implemented as part of the Affordable Care Act. They find that the distribution and characteristics of medical industry payments to physicians or teaching hospitals, as well as physician interests in manufacturers, varied widely by specialty. For example, cardiovascular specialists were most likely and pathologists were least likely to have received industry payments. And our third highlight in the January 2016 issue is an original article that addresses the incidence of systemic autoimmune diseases in World Trade Center exposed firefighters and emergency medical service workers. This article was authored by a diverse group of authors from several healthcare and public institutions in New York City and from Mayo Clinic in Minnesota. The group was led by Dr. Maris Weber from Montefiore Medical Center and Albert Einstein College of Medicine. They compared the incidence rates of selected systemic autoimmune diseases in approximately 14,000 male rescue and recovery workers who are followed by the fire department of the City of New York World Trade Center Health Program with the incidence rates from demographically similar men in the Rochester Epidemiology Project. Go and read the article for details of this really interesting project. You can find these and many other free articles on our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org. And while you're on our website, connect with us on Facebook, Twitter, and YouTube, and maybe even take our survey about our internet presence that you can find in the upper right-hand corner of our homepage. And we'll see you again soon enough when it's time to share the content of the February 2016 issue. Until then, thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.